gonna be taking us
Cool.
around the golf cart today. So
He's
we
on
didn't
Golf
want
the
to
cart.
do
he's
this
on
and
a
drive
golf,
and get in that car accident.
he's on the
Yeah,
golf cart
You
today.
guys
I
are
like that.
hilarious.
safety.
So hilarious. Let's
Yeah.
see here. Let me get
Andrew want to make a shout out to his mom later too. So
Yes, hi mom.
shout out to mom. Love
later.
it.
And should we mention there's some other sites too I found here on the Garden Grove site. I don't know if we want to mention any of those or just stick with this or
The Garden Grove site?
no, I'm just saying
No, it's actually the next one we're talking would be the OC Fairgrounds.
OC
Fairgrounds.
Fairgrounds. Got
Yeah.
it. Okay.
Yes. That's being cool. I see you on live now. And let me share this to where else
Should
can
I leave my mask on or take it off? What do you think is best?
I think you should start with it on, and then you can take it off. It actually,
Okay.
either way, I mean, it looks fine. It kind of sells the message to what you're sending here. So,
Yeah, and we're pretty close here, so
yeah, I think that's
So-
good.
Yeah, you look handsome, no worries. With the
you.
mask on.
Yeah.
All
Okay.
right. So today we're how exciting to be able to do a virtual tour for folks who can't physically make it.
Yeah, right.
Yeah,
I know this
yeah.
is only on OC, only on Health Talks with Dr. Trin here. All right, well, I'm ready to go. Everybody
All right.
tuned in?
You want to count me down? I'm ready.
I will. Here we go. You ready, Dr. Trin?
Yeah.
Here
On
we
the
go.
outside.
Let me make sure we're recording here. Okay, here we go.
Right side.
Everybody take a breath and pause, and we'll go in 3, 2, 1. Hey, welcome everybody. Today's another edition of Health Talks with Dr. Trin. Back on the air to give you some common sense ideas how to handle all the crazy health crises taking place today here, and your questions, as always, through our Facebook Live page or YouTube Live. So let's get things going. We're breaking ground here today, something we've never seen before with Dr. Trin. Welcome, Dr. Trin, and set us up. What are we going to do today?
Hey, good morning, guys. So yeah, we have Vince and Andrew. They are on the ground at Anaheim Convention Center, which is a new super site for COVID testing, and so they are going to give us a virtual tour. Actually, for those of you guys
Yes.
who want to know what a test site looks like.
And I'm fascinated because everybody talks about what does it take to be tested? Why is it so difficult to be tested here in Orange County and elsewhere? I think this is a welcome addition, and I welcome the information, and I welcome the first ever live. We've got a live camera crew live on the ground here at.
Yep.
And where is this? Is Anaheim Stadium?
This is hi, good morning, Paul. This is Vince. We're at the Anaheim Convention Center.
Anaheim Convention
right now.
Center. Okay, right.
Yeah.
Yeah.
And so we just want to bring to you today, right now, we're opening up the gates right now, 8 o'clock start. And we have cars coming in right now. If you want, I can flip this camera really
Please,
quick
yeah.
right here.
As
Yeah,
we
flip
speak,
it.
you're at the
So
Anaheim
we have the
Convention
line.
Center live.
Okay,
Right.
so we're going to pull up to the Station 1 right now. And so you see the Station 1 is where people will have their registration number out and with a photo ID for us to check on them. Validate their identity here. So
Okay.
here cars are lining up in twos, and our
Wow.
concierge team are checking the ID and also insurance right here as this line. And then we have some instructional signs here for the community. Yeah, so
Look
this
at
is where they show us the email confirmation that they received from us. Right on the day they booked the reservation.
Can you walk up
Okay.
to any of these people and just tap on their window and say, "Hey, could we ask them a question or anything here?"
Actually, because you know what it is that we designed this drive-through site to be contactless. So as
okay.
little interaction as possible. Right now, they're putting the ID on the windshield. You see, as this gentleman right here, he's putting ID on. So we want to keep the windows up, and
Got
then
it.
also to minimize the contact between our staff and the patient, just for the safety.
How about any of your staff as they open? Are any of them available just to give us a feedback of what people, how people are reacting to this, and what they're seeing, what questions they're having, or
Let me see here.
think
One
of
second, maybe there.
maybe there's somebody we're at the registration to check and say, well, what do you think people, just to get some feedback from people. How are people reacting to this? How did they hear about it? What do they think of the
Okay,
process?
okay. Let me pull up the concierge team. She's with us for a couple of days already. Hi. So say hi to Orange County really quick. Hi. Yeah. So they just want to ask you, what do you think about the registration process so far, and
What are people asking?
community response?
Yeah. What's the
I guess
community?
you're a little bit busy right now.
Yeah.
Sorry.
Well, that's okay. We'll get, as we go on, we're here for a while. So maybe your assistant can go grab somebody there and just tag them if we get a chance, and then we'll go ask them. Because I'm fascinated to know how did people hear about this, and why are they coming? Do they have symptoms? Are they just being precautionary? We're here so much about testing. This is the first time I've ever seen a test site.
Yes. So reservations, you can follow us on our Facebook page for 360clinic.md. That's our Facebook page there. And it constantly updates new bookings every day.
Get a little closer to that so we can zoom in on that a
Okay.
little bit. If you
Sure.
can. Just hold it there for a second. So give it to us again. I can just barely read it there. Okay.
Oh, sorry.
There we go.
To remain update on appointment openings, follow us on 360clinic.md.
360clinic.md. And how did you hear about this, Dr. Trin?
Well, these guys are buddies of mine, so they just told me
you know
about
everybody. You know everybody.
Oh.
And so give us the background. How did this thing evolve? How did it get to the convention center? What do you guys do? Is this a for-profit thing? Is this a non-profit thing? I don't know what we're looking at here.
Okay. So just a little introduction about myself. I've been in the home health and hospice industry for 14 years now. It's a family-owned business, and here we are. We got this opportunity to help the county. It's really funny. I mean, I'm an immigrant myself. I came over in '96, and I didn't know that on July 1st, I would get a call from the Orange County Health Authority saying,
Right.
"Hey, we like your model. We need testing right away, right now." So
Right.
then they tell us, "When can you open?" And then so here we are. We opened on July 15th. So super excited about that, and with the team here.
So is this an entrepreneurial opportunity for you? I mean, is this something you guys are doing to not just to help out, but to help?
Absolutely.
Right?
No, we just want to help out the community, and this is our chance to give back to the community that we all live in, and this is the big chance for us to, again, just to help our community in this time of the pandemic.
So does the county hire you to do this, or are they just giving you the space to do this for free? I don't. What's the connection?
So the county giving us in the city of Anaheim, in the convention center, giving us the space to run the operations here.
Okay.
Wow.
Yeah.
And what, I'm just curious. So again, I mean, they contacted you, or you contacted them, and somehow how did this thing come together here?
So we started doing COVID testing. Our first drive-through was at a church in Garden Grove with the help of Garden Grove Mayor Steve Jones. He helped us with the location at the church, and we were able to do 300 testing on that first day. I remember it a little bit after Memorial Day weekend.
Wow. Okay.
And that's what we started. And then from there till July, we did approximately 5,000 tests, PCR swab tests, the nasal test. And then we had a proposal that we just sent to the Orange County Health Authority, and they liked our proposal. And with the grace and the blessings of Dr. Clayton Chow and also Dr. Donna Fleming, she was the first one that gave me a call to saying, hey, we like your proposal. When can we meet? And I didn't know that. She's like, okay, let's go 2 weeks right away.
So we're going to take a whole tour, and you're going to explain to us what goes on in a test, all that stuff here. But I just want to get the background stuff first as people are tuning in. And people hopefully will call in and ask questions about, because I don't really know. I've seen various things about how a test goes and different kinds of tests, and can I get a test even if I'm not sick? All those kinds of questions we're going to go through in a little bit here. But I just want to get the background out of the way here. So you guys came up with this idea of how to do drive-through testing. You did it early, and then you sent a proposal in, and Anaheim responded back eagerly, or the Orange County Health Authority, and said, hey, absolutely, this is a great idea. Dr. Trin, we've talked about this so often. Why has it taken so long for test sites like this to spring up in Orange County? Why weren't these here April 1st?
Organizational skills, and really just having adequacy of test equipments. If you remember back then, we had a shortage of
yes, right. We couldn't get anything. We couldn't get the
test kits.
swabs. We couldn't get the
Yes.
reagents to test them, to test the
Right.
swabs, and then we have all this stuff, whole mess.
Yes.
Has any of
But
that gotten better now? Have we got enough swabs? Have we got enough? What's the reagent? The stuff you dip it in to see what color it changes, or what
Yes.
happens to it?
Yes, it is. It is the little droppers where you drop in the medication, and it's like a witch's cauldron. It's the reagent.
That's a scientific explanation. if I've
Yeah,
ever
that's
heard
my
one.
reagent.
And then now, are these tests sent out? And does it still take? How long does it take to get a result back?
I can answer that one. Yes, so that one right now, results are produced in 48 to 72 hours,
Wow.
and
Amazing.
delivered to the patient by 72 hours, either by email or text.
Now
And then
you
they
got
go
me
on a,
excited.
yeah. So they go on the portal, delivered by Healthvana, and it give you all the result, and you can print it. And then if people need it for their employment status, anything, they can download that as a PDF file.
Yes, because I was just watching, I don't know, CNN or something the other night here, and some great grand poobah, somebody that I'm sure Dr. Trin knows. He knows them all across the country here. But this guy was on talking about how frustrating it is because they're taking 7 to 10 days to get results back. And in that time, you're running around infecting everybody, maybe. By the time they tell you, they can't trace who you've been with because you've been running around for 7 or 10 days.
How did you get such fast turnaround time when the rest of America is waiting for like a week?
Or more. Yeah.
Yeah, we work closely with Fulgent Genetics Lab in the City of Industry, and they're also working with the county for other sites as well. And so that's why they're able to exclusively help us, and with the volume that we want to do for the county. So they're willing to get more machines and more manpower to help us expedite that and help out the community in the time right now.
So,
That's amazing.
so you're
Yes.
getting a test result in somebody's hand within 72 hours. Within 2 or 3 days, I'm going to know whether or not I got
Yeah.
this. Now, talk
And it's
to us.
not just business days; it's actually like over the weekend. This lab runs 24/7 as well. It's not just
Right.
business days.
So if you did it on
Yeah.
Friday, you're not waiting till Wednesday or Thursday. We're back to a week again here. All right.
We
So
had a patient that tested on Sunday at our site. The sample was delivered to the lab, and then they got a result Monday in the afternoon.
oh my goodness. See,
Wow.
that's what we've been
Yeah.
waiting. Hooray. We're going to give you some applause here. Let's get some of the, we're going to open the
Yeah.
doors. What do you think of this
Yeah.
crowd here? We'll see if we get some reaction here this morning. I know we've got some people standing out there. I can't find them though here right now. Well, okay. I was looking for the applause thing here. I can't find it right now here, but okay. So part of the problem is that we haven't been able to test. How many people are you able to test in this facility a day?
So far we have tested over 2,000 people in our first week already.
Wow.
Yes, and
Wow.
so today we have a capacity of 500, and tomorrow we will be doing 800, and for this weekend 800. So we're fully booked for Thursday and Friday, and also that registration will open 24 hours ahead at 8 in the morning every day.
Hmm.
So just for the
So
for your
there's a
viewers there.
limited number of kits or whatever you have. You've got a finite number. You got 500 or 800 or something. When that's done, you're done.
Yes.
So can walk us through the process one more time. How do people find you? How do they sign up? When can they sign up? And what's the cost and all this kind of stuff? Give us the
Yes.
details.
So there's a website that it's called the Orange County COVID
19.
testing.
Mhm.
I think it's called the
I-
super site.
Yes, I got the link posted already in the chat.
Oh, good. Okay.
So
Yeah.
for those of you guys on Facebook Live, it's I got the link posted on chat.
So-
Yes. Oh,
under
great.
healthcare. Yeah, so they can take a look at that link there.
Yes,
Okay.
that's the
Explain it.
link for the county website. It has a lot of information for what the criteria and symptoms and walk-ins eligibility for, fast lane, basically for frontliners, nurses, city workers. They don't have to worry about making reservation. They can just come to station one at the registration and show us their badge, and we'll let them in. They no reservation needed. We want to help them get through really fast.
You're talking about the front, somebody works at a hospital or somebody else.
Yes,
That's a
or
doctor.
like a skilled nursing facility.
Right.
No reservations
police.
needed? Really?
Yes,
For those
we'll
people.
Take them in.
Yeah, for
We'll
those
take-
people.
Yeah, for
right.
those people. Yes, we want to help them because
Oh.
on my first day, I already had some city people coming by, and they've been exposed. They couldn't get to their doctor to get a test, so they're looking for help here. So we took them in right away. Yeah.
Wow.
So all the criteria is on the county website for the eligibility of getting fast lane and priority.
And I'm going to, for those who are listening today through OC Talk Radio and for whatever reason can't go to Health Talks with Dr. Trin, the Facebook page where all we're talking about right now, taking questions. If you can't get there, or if you're listening on YouTube or anything else, it's OC COVID-19, OCCovid19.OCHealthInfo.com, OCCovid19.OCHealthInfo.com, and then /supersite. Or you can go to these folks' website, which is 360 Clinic, the three numbers, 360clinic.md. I didn't know there was a .md extension, but apparently you found one here.
Oh yeah, very hard. We got it. Yeah, and then on top of that, I want to add that we're looking into next week or the week after that to do priority lane for 65 plus seniors.
Oh, now we're talking. Boy, you're hitting all the
Yes,
hot
because
buttons.
the data that we've seen, the data we've seen from last week, we noticed that not many seniors are able to get reservations or to come on site.
Yeah.
So we want to we're talking with my operation team to give maybe an hour or two in the morning every day, so to prioritize them. And we are working to get more manpower to help them through with the registration, because I know that the website currently is only in English, and we're also working with the lab to get the website, the registration, Google translated into various languages to help them with that.
Yeah. How do you
Yeah,
I
reach?
like
How do you,
I
for
like the
example?
senior lane.
So, for example, you're both You're both
Paul,
Vietnamese.
yeah, come by anytime, Paul. We'll take care of you in the scene.
I am. Yes. Believe me, I'm going to take advantage of this. So you're both
Absolutely. Tell
Vietnamese.
your friends.
How do you reach the Vietnamese community, particularly the older folks who maybe don't speak English very well, if at all? How or can't get out and around? How you read? That's one community, or Hispanic communities, or Indian communities, Persian communities, or Chinese communities. There's so
Right.
many ethnic communities here in Orange County. I think at one time I think I've seen it's like 30% of Orange County, or maybe it's more than that, are immigrants from some other place. Very high percentage of people from other countries. They may or may not have access to all this information. They may not be able to read it or hear it. How do you reach out to people in other ethnic communities?
Yeah, so we just work with a various religious group in the community to get the word out, like Buddhist temples, Catholic Church, everything that has a congregation of people of that ethnicity. And then also we're working with translation services where they would call a number, and that translation service would help walk them through that registration
Wow.
if we get too backed up. But if not, then our team is working to get our staff bilingual as well for the community, especially Hispanic and Vietnamese here, and then so that way we are ramping it up. So that's why the number right now is only 5,800, but in the next 2 weeks we're expected to do max capacity.
And what would that be, max capacity?
Max capacity around 1,200, sir. Yeah.
1,200 a day.
A day.
Hallelujah.
Yes.
Dr. Trin, what's the numbers to date? We're in what month?
Yeah,
March, April, May, June. We're in 4 or 5 months into this thing here.
we're in July.
Right.
So guys, we got some questions here on Facebook.
Yeah.
Uh, Somebody asked, where are the data results being reported?
Mm.
So,
Go ahead, Andrew. You want to?
The data from our lab is being sent to the California Department of Public Health as well as the county. So on both of their pages, all of the data sets include ours.
And
that's
is it blind information, or did they say Paul Roberts has COVID or Paul Roberts doesn't have COVID? I know people are
Of
concerned
course
about
it's
privacy.
blind. We don't want to. We don't want to share that like public health or private health information, of course. But we do have to report name to the Department of Public Health so that they can start their contact tracing program.
Got it.
But outside of that, none of your information is shared.
So if I do test positive, God forbid, and then you're obligated to tell the county, yes, Paul Rod, we found someone, he's got it, and then they contact me and start some contact tracing program. All right, where have you been? Who did you talk to? Let's contact them all quickly and let them know that you either tell them or we're going to tell them. How does the contact tracing work? I have no idea how this whole thing works, and how well organized is that, Dr. Trin? Or either anybody. Okay, I'll throw it out to you guys first, Vincent.
So we have a group of nurses at the Orange County Healthcare Agency whose role is to try to identify and inform others that they may have been exposed to somebody who got COVID, and so it's a manual, hard job to try to find folks, and it's more difficult to do that if your results come back in a week after you spend an entire week hanging out with people.
Right. Yeah. Right. It's much better if you can do it in a day or two. And so I'm just trying to be clear and just go through this a couple of times. So I drive through the site. You guys find that I have it. You tell me within a couple of days, a day or two, that I've got it. So I can go out and tell the world, hey, my friends, my family, my coworkers, hopefully I'm a responsible person and I will do this. But you also report this to the county, and the county then will contact me, hopefully not 2 weeks later, but hopefully, rapidly. And then they what? They start asking me questions. Where have you been? What restaurants you go to? Where do you work? Where did you shop? Et cetera, et cetera. And then they start reaching out to those people and sending them. Do you get a notice in the mail? Do you get a phone call? How do they do it?
Right. Actually, our model, Paul, is different from other drive-through sites because we are a provider-based model. So we have physicians that will watch you after this. We're at station 2 right now, but after this, I will take you into station 3. That's where our provider will watch you to do the self-swab kit, right? Mm-hmm. And then we will follow the guidelines of the insurance to check for your medical necessity, right? So then if you get a positive, our physician team will contact you as priority right away to make sure that you the patient follow necessary steps to contain the disease at home.
Right.
And rather than stress and going to the hospital and stressing out the ICU beds and the skilled nursing facility and everything like that. So that's why our model is particularly interesting and different compared to the model, let's say in LA or at Dodger Stadium, anything like that, because we have our provider to follow up with you. So the testing is not that just come here and testing and get a result. That's not it. So for us, especially with the positive patients, we have to follow through with our provider, and we provide also what we call RPM devices that will launch later on in next month to help the patient. It's called RPM, is remote patient monitoring. So that will help the patient, and it's covered by the insurance as well. So to help the patient to stay at home and help contain this disease right now. And in the meantime, while you take this test, we are passing out flyers from the Orange County Health Authority to advise you what to do if you are feeling symptoms. If you feeling the symptom, what to do right away. We don't want you to wait until you have your result just stay at home and to quarantine yourself. If
Right.
you're feeling symptoms right now, take the test, but please stay at home so we can contain this. That's the best way.
So what
Yeah.
happened? I'll get slightly political here. Maybe I'll just open the crack a little bit, because I don't want to turn this into a bashing of anybody here. But in the beginning, we saw from the president on down a discussion of we're going to do this at Walmart, we're going to do this at Target, we're going to do this at CVS, we're going to have sites all over the place. Don't worry, folks. Test. If you need a test, you can get it. That disappeared. That's the only thing that magically disappeared. What happened to that whole initiative here to get massive distribution of tests out through big box retail? Why are we going through individual entrepreneurs like you guys? It's America. Thank God somebody stepped up and said, hey, I got an idea and a model, and let's see if we can make this move. But it's been sorely lacking. Why? I'm totally lost why giant hospital chains didn't come up with this whole thing, or giant drug companies, or county. Why are we waiting for individual entrepreneurs to come up and solve these models here? Any ideas? What happened to these massive rollouts?
Paul, I mean, honestly, we are just a medical group. We just want to help people. For that answer, maybe if Dr. Trin can help us out with that.
He doesn't want to go there. He doesn't
Yeah,
want
we're
to
just
talk
a
about it.
medical group, and we want to focus on helping the community and bringing out our providers and our clinicians team.
Because
And,
am I correct? And then I'll end it here. We won't go down this rabbit hole any further. But I felt from the beginning that had we had the ability to quickly test lots of people as this started to break out in small groups, we could have contained this, or we could have done a much better job of stopping its spread. Instead, it spread wildly, and now it seems like a wildfire that we can't get our hands around here. Is this just is it too little, too late? I guess we'll go there. Was it too little, too late? Should we just forget it and we're all going to get it?
Never too little, too late, because for everyone you identify and inform, that person is now more careful to stop the spread.
Right.
So never too little, too late.
Okay.
But I have the same questions. Why isn't this being done at all the Walmart parking lots and all the parking lots of big retailers right now,
Yeah.
as it should be?
So there are a handful of other testing sites. I've seen some pop up. Memorial Care that you work for, Dr. Trin, I think has one in
Yes.
San Clemente. There are some other ones I've seen here and there. I know the UCI has one over off of campus there somewhere. But they all have different priorities. That's one of the biggest questions I have. What qualifies me to go? Do I just say I want one? Do I have to go get doctors ordered to get one? Do I have to have symptoms, or am I just scared and I want to know? Any criteria? Any?
So we since we're partnering, this is a public-private collaboration with the Orange County Health Authority. So we would follow all their guidelines on their website, as you can see, and it just lists out all this what they want to prioritize right now. I believe it's essential workers and people that have symptoms as well. So all the guidelines will be on their website right now.
So I have no symptoms, thank goodness, but I'm always worried, like everybody, and I'm especially at my age. I'm in my mid-60s here. So could I just come and sign up and go get a test even though I have no symptoms, or should I wait until I get a symptom? There's a question. Oh, nobody jumped on that one. What do you think, Dr. Trin? Should we all just go get tested, every man, woman, and child, or should we don't have enough and we got to prioritize and only the sick and the needy get it right now?
That card line. Go ahead, Vince.
Sorry, back to you. After you.
Yeah, after you, Doctor.
No, go ahead. Yeah, I think we are prioritizing in the sense that we can only do like 1,200 a day when we get maxed out, right?
Yes.
So you all were going to say something. What opinion? So should every man, woman, and child rush down and get tested, or only those who are at high risk or have already a fever?
ideally, we would like to test everyone because though you're not symptomatic, there are asymptomatic people and they're
Right.
transmitting it throughout the population.
Right.
It's just right now, the public health initiative is that we have to prioritize the resources that we have.
So I'll go back and ask my basic question again. Paul Roberts wants to come get tested. I have no symptoms. I have no underlying condition. I don't have a heart valve or something. Can I just go get tested even though I have no symptoms and know nothing, just for peace of mind? Or do I have to wait?
So if Paul Roberts is someone over 65, we definitely will take you because you're in the high risk age.
Yes.
Yeah. Yep. That's my honest answer.
Okay.
Yep.
So just because of my age, I could get tested.
Absolutely. Yes. We want to take care of our high risk population.
And
But
this
you
is our
look
first-
young, Paul. You
I
look
do.
young. Don't worry.
So that's what they wouldn't take. They would show up and they say, "You can't be 65. Come on." You know, I'd have to prove it to
you
them.
look-
Think of
You
it like
look in
like
your
a
40s.
senior discount. I mean, this is the way.
Now we're getting even better. Now we're
This is where
getting.
it works here. This is where
All
you get
right.
priority.
We're making a deal here. We're a little horse trading. I'll tell you what. All right. So
Actually,
go
is there a
ahead.
cost to this? Is there a
Yes.
cost to this?
My next question.
There's no out-of-pocket cost to patients at all, and that's mandated by statutory law. So there's no co-payment, no prior authorization. You just sign up, put in your information, and then you're good to go. And Paul, going back to your question about testing everyone, on our second site, in our second location, hopefully we can have more ability to test people that aren't showing symptoms,
Right.
that are at lower risk for being exposed to COVID-19.
Because that seems like that's how we get ahead of this. If we could start
Right.
identifying people who have not, if we wait till they all have symptoms, they've already infected a ton of people.
Right.
If we can get to them early enough, we can limit or stop the spread of this disease. It's massive testing was the answer from the beginning, folks. That's my own personal opinion. I know we didn't know how to do that. I know we didn't have the swabs and the reagents and the test facility. Originally, the CDC said we want to control all of this because that's what we do in pandemics. We want to count it and then it quickly spread. And then nobody was sure, do I do it? Does he do it? And confusion reigned. And now here we are 4 or 5 months into this, and we're just figuring out how to do testing like this, you know. And so now the question is, do we test only those? We're sort of always behind the curve. Oh, he's got it. Let's go tell everybody, you know, that rather than trying to catch the next group of people before they get it or as they get it.
Yeah, there's a comment on Facebook, and Paula says, in senior living, so seniors who are enrolling incoming new residents to the senior living facilities, it's the state is suggesting that any incoming resident need to go get tested first before they can be accepted to a senior living facility. But the barrier to that is it's very difficult to get an order from the primary care physician to go get tested.
Why?
Just because you're asymptomatic and you need to go into a senior living center. So that's a big barrier now in the medical community. So a site like this is awesome because you can just use the senior fast lane and get tested.
Yeah.
Right, and get
Yeah,
tested
absolutely.
for something like this.
Now, without these facilities, what's been available? What's the current? Oh, we lost them there. There they
Oh,
are.
sorry. I'm back.
Up until now, what's been the normal process? I go to my primary care physician, my doctor, and I say, I want to get tested. And he says, Paul, you don't need it. You're not sick. We don't have enough tests. Or he says, Paul, you're of a certain age, or you got a certain condition, or you're going to, you're getting ready to move into assisted living. Absolutely, Paul. Here's my order. Take it down to LabCorp and make an appointment like you would any other blood test, and they would do it. But is that the normal process of what I go through? Other than these test sites, I have to go to my physician. He writes an order, and I go to some big company like LabCorp.
Yes, that's the process. Except most of the time, what happens is we have these guidelines where because of limited test kits available to these medical groups, they are prioritizing to those who have symptoms to get tested.
So say that again. All right. So each doctors belong to medical groups. Most of them don't exist alone anymore. I guess they're part of a practice that's affiliated with something, with a hospital or a group or whatever. And those groups or hospitals that they're attached with only get X number of kits that they can dole out.
Right.
Horrible.
Yeah, and so it's supply and demand, right? It's supply and demand, and so this is why a test site like this solves that problem. If you can't get to your doctor to get an order, and you need to know, who else is going to take care of that for you?
Yeah. Well, and let's look at the lag time. So I've got to get into my doctor. That's not today. That's
Right.
sometime this week.
Right.
A couple days go by. Then he writes me an order, and I got to get into the testing lab. And might be I can walk across, but probably it's got to come back a day later or sometime later and make an appointment to go get my blood drawn or run out with a swab or whatever it is. We're going to talk about that in a minute. So I've waited a couple days to get to my doctor, another day or two to get into the lab, and then I wait a week. This might be
Yes.
2 weeks that have gone by.
Yes, it's we need to improve on all that.
Whereas I can set up an appointment. And again, how far in advance can I schedule this? I have to wait just 24 hours, or can I do this?
24 hours, yes. So starting next week, we will open bookings 24 hours in advance at 8 in the morning every day.
So I run to the site, it filled up. And then I run to the site next day, there's still an opening. I grab one.
Yes.
Okay.
Yeah. So next week we'll be doing close to our max capacity. So hopefully you're able to get in, Paul. Again, we have the priority lane for you. So
I know the guys. I got the VIP lane here. They stop all the cars. They move them aside. I drive right up here. So, all right.
Yeah.
All right. And if I go on the site, what do you ask me? Just when do you want to come, or do I have to qualify?
So if you're walking on, are you walking? Are you
No,
talking about
I'm
walking in?
I'm gonna go on the site, and everybody's gonna go on the site, and then are some of them gonna get turned away and say, no, you're only 33. We're not gonna test you. Sorry.
No, so it's the registration site that's on the county. You answer the questions on the registration site, and then they will give you a confirmation number. That's if you're not a senior. But if you're a senior, we can take you as a walk-in, and we will have people here to help you.
As a senior, I can just walk up. I can just. Oh, come on! You didn't say that.
Oh, I'm sorry. A drive up.
Drive up,
This is
yeah.
a drive-through model. Yes.
Right. But so if
prepare
I'm
you as a walk-in.
65 or older, anybody who's 65 or older can literally just pull up to your site, wait in line, and if there's a kid available, you go for it.
Yes, absolutely.
This is fantastic, guys. Why aren't you shouting? Why isn't KB? We're the only ones there. Where's KABC today? Here, where's the channel? So where's CNN?
Yeah, they came out the first day, so we're waiting for them to come out some more. Hopefully, you can invite them for next week. When
I
we have more
will.
cars.
Call my friends up at all these other outlets here. Yeah.
I actually
Yeah.
want to see. I actually want to see a tour now.
Yes, let's
Okay.
take a tour.
Yeah,
Yeah. So okay.
Turn the
So
camera.
I'm gonna turn the camera around.
and then
so we're
drive
gonna-
around. I want to see how it looks.
We'll pull up closer to station 2 here,
Yeah.
and then go ahead, and then I'll get off, and then we can say hi to the staff really quick,
Yeah.
okay? And then I can show you guys the swab kits as well.
So I feel like I'm driving up right now. Here I am in my
Yeah,
car.
so
I'm
you see all
driving
these
up.
cars driving up. This is what you do. So that truck is coming
Wow.
in from
Look at the
station 1,
look at the
Yeah.
lineup already.
and he's coming down the lane there.
Right.
We'll let him pass.
Yeah, don't
And
get.
then so these people here also are getting signed in,
Right.
and so they're getting the swab kits right now. And look, doctor, look who it is.
Who's that?
Mary-
Hi, Lizzie.
Lizzie.
Oh, that's
Lizzie
my
is your
daughter,
dad.
Lizzie.
She's a little busy right now, so yeah. So yeah, this is our team here, and they're processing the self-swab kits.
All right, so stop there.
Yeah.
You're giving us some mumbo jumbo here. I want to understand. So
sorry.
I pull up, and what happens?
Yes.
Somebody, I show them my ID.
So here, let me show you this one right here.
Yeah, walk me
So
through.
this one, she's checking in this truck right here that just pulled up.
Right.
Oh.
Yes. And then you see the windows are still up. We're asking for people to show their driver license. We have
Ah, look at
signs.
that. You just show it right
printed.
through the window there. Yeah.
Yes,
cool.
and then she's taking a picture of the driver license there,
Right?
right?
This really
And
is contactless. Yeah.
and she's checking if she's holding a sign if that person has medical insurance. She would like to take a picture of that.
Mm-hmm.
And why do
Yeah.
you need the medical insurance if the test is free?
Oh, that's just to confirm. So that's how the test, because right now all the insurance is mandated to cover for
I see.
COVID
So
testing.
they get
Yes.
billed for this. I see. Okay.
Absolutely. Yes. No bill will be coming to the patient, but just going to
And if you
their
do not
insurance.
have
Yes.
medical insurance for some reason, you're supposed to in the state of California.
Yes.
Everybody's supposed to have it.
So
But if you don't,
if you don't have insurance, there's under the CARES Act, also HRSA, that will help you cover for the expenses of the COVID testing.
all right. So she took. I'm just trying to be clear here. No window
Yes.
came down. Nobody breathed on anybody. No droplets were
Right.
exchanged. She
Right.
took a picture of your ID and confirmed
Yes.
that you're on the list.
Yes.
And then she confirmed you held up your little insurance card, and that's who's going to get billed for this thing here, not you. And
Yes.
then what happens? They hand you a kit, and you do this yourself?
So, and then she's gonna bring this paper back, letting the patient know, and we have our technician team here. We'll scan in the kits as well. So, you guys, can I borrow a kit really quick? Yeah. So this is one of the kits that we'll give to the patient. So in here it's a self-swab kit.
Keep that one
We'll
for me.
see-
Just put that one in your pocket, will you? Just keep that one for
Okay.
me. Yeah.
That's
You
what
got
Paul.
it. You got it.
Yeah.
Yeah. So we have a swab here, and then so when they're done, so this is all under the provider assistant over at the station 3, which I'll take you guys in a bit.
Okay,
Right,
so they
so,
and then at this point the window does roll down and somebody hands me this kit.
Right. So we have all these grabbers here to kind of
A grabber. You even got a grabber to go like
yeah,
oh my
yeah,
goodness.
just to keep the distance, and then so our team here is in full PPE
Yeah.
as well, and then here maybe one of them. This is how I'll take you guys to.
Yeah,
one
let's
of
see
the
somebody.
cars
Let's
here.
see somebody get a kit here.
Yeah, so here she's knocking on the window, okay, and then she would use the grabber to give the kit to the patient like that.
Look at that. Oh my goodness.
See?
Yeah, look at-
Yeah. And then she's instructing them that wait until they get inside the parking structure
Uh-huh.
to give the to do the swab.
So you then park your car and you do this yourself, right?
Right. Under the supervision of a PA or a nurse or a doctor.
Oh, somebody watches you, so you don't stick it in your ear
Absolutely.
by accident and something. Yeah, right.
Absolutely, yes.
All right, walk
Yeah.
me through what happens, Dr. Trin, in testing myself, because I've heard reports. We're going to squash rumors here today. I heard this hurts. You got to stick it way. You can't just wiggle it around the inside of your nose. You got to stick it way up past your eyeball or something here. Is that true?
It's probably not as bad as me checking your prostate exam.
Yeah.
You're gonna be fine.
But I mean, is it something? Do I just swab the inside of my nose, or do I have to get way up there?
You gotta get up there a little bit, but it's under supervision. Somebody is there watching you and checking you. So it's not like severe pain that has been touted. It's definitely
Yes.
something fairly quick.
Because I've heard it's severe pain. Now, I have a severely deviated left septum, so I'd have to use my right nostril, right? Because I can't go up very far in my. I got busted in the head when I was a little kid playing baseball, and I never got it fixed here.
It wasn't a bar experience, Paul.
It was it was a bar. It was late at night. There was a couple of bottles involved. No, I didn't want to go there. But okay, so I stick this up my nose, and then what? I pull it out, stick it in the bag.
Yes.
Now what happens?
And you will just drop it off at the end. The
yeah.
physician will
Right.
instruct you how to swirl around in the nose and both nostrils, and then put it back into this liquid vial here, and seal up in this biohazard bag, and then we just drop it in the. We have a bin at the end of the line.
Now again, I do have I'm not kidding. I really do have a severely deviated left nostril here. So do I still have to jam it up into that? Because that would be a problem for me. Do I have to use both
No, so-
nostrils?
Yeah. So you don't have to jam it up because this it's not. It looks long like this, but
Yeah.
really you're gonna break up half of it. You're gonna only use half. So Dr. Trin is, I think it's called mid interiors. So not that deep. Yeah.
And it has to be in both nostrils or just one?
Both. So then both there would be two sticks and two
Two
swab
sticks,
ends.
one stick,
Yeah,
swirl it around. What do you twirl it a little bit to try and get some of
yeah,
the goop or something in your nose here,
yes.
the
And then
nasal.
also, I want to show you this. This is the flyer that goes with that swab kit from the Orange County Health Authority. And again, this is to inform the patient to been tested, what's next, and then so very good information from the Orange County Health Authority.
I can ask you a tough question here. What's the false positive ratio? How many of these come back with a false? Not through anybody's fault. I know nothing's perfect. I'm not trying to blame anybody, but are these 100%, 80%, 90%, 10%? What's the accuracy on these tests?
Well, at the kits right now, we see very low false negative because it's running through the PCR, and maybe like
What's the PCR? I don't know what
I'm
a
sorry,
PCR.
the PCR is the polymer nasal swab.
Okay.
And so out of the numbers, so far we have found maybe inconclusive would be maybe like 50 out of 2,000 tests already. So it's very, very low numbers.
What are you seeing,
Yeah.
Dr. Trin? Because I had somebody on a show the other day, and he said, my first result was I tested positive, and then I went back and I tested negative, or the reverse. I tested negative, and people, again, lack of trust. Then people are saying, well, the heck with it. I don't even trust these things. It's only 50. I'm not going to really know.
The PCR testing is more accurate than the serology finger stick testing.
Really?
Yes, that's correct.
The nose, sticking it up your nose is better than getting a sample of blood?
Yeah, getting the sample of blood is looking for antibodies, which is different.
Right.
Sticking it up your nose is looking for the virus itself, the presence
Come
of the
out. Get out of there, you little guy. Come here.
virus. Yeah.
Come here.
What's your percent positive rate so far that you've done? Had?
How many people
Yeah,
how many people test positive as they come through your 800 a day here right now?
Yeah, the numbers we're seeing is actually matching what the Orange County Health Authority is producing every day. We're seeing around 12 to 13% positive rate right now.
Wow. And
Yes.
are these primarily people who are exhibiting symptoms again, or are these people who are, because they're 65 or they're a healthcare worker, are just doing it to know, just out of safety? Are we discovering many people who were asymptomatic but had the disease?
Yes, so the data is still coming in, and so we're processing the data from last week as well. So we will have the complete data for the Orange County Health Authority this week for that numbers. Yeah.
Because I guess that's what everybody wants to know. If you came over to my office building here, and now, although there aren't many of us here in the office building right now, if you came and tested everybody at an office tower or at a restaurant, we go into a restaurant tomorrow and we just say, hey, folks, everybody take a seat. We're going to give you a free test just to see how many of you have this disease. What do you think the positive ratio would be, Doctor? I know this is a wild question, but what do you think? How many of us are walking around and we don't even know this? If we just tested people randomly at the mall or something here.
The CDC recently announced that they believe probably between 30 to 40% of COVID patients are asymptomatic.
Wow.
That's a lot.
That's a lot of people. And how many how many people have we tested so far in America? 350 million people. What have we tested? 5%, 2%, something like that. A couple percent.
Yeah, not a lot. Not enough.
Not a lot.
Well, we're going to
Not
test.
enough.
We're going to test 1 million people through this site alone. Here, I'm guaranteeing you. The 3 million people, 1 million people are going to come to 360clinic.md and sign up. 1,200 isn't enough. Can you get up to about 12,000 a day? Well, how do we ramp this thing way up here?
So that's what we'll be discussing with. Oh, I'm sorry.
That's okay. We lost.
Sorry about that. Yeah. That's what we'll be discussing with the Orange County Health Authority on this Friday regarding at the OC Fairgrounds. Yes.
So you're gonna. There's future ones coming up. Right now, you're at the convention center. How long do you stay there? Forever, or just for a week?
as long as we or the county asks us to stay here, Paul.
So this one's
Yeah.
open. Is it 7 days a week or 5 days a week, or and what
So
are the
right now it's
hours?
5 days a week, Wednesday to Sunday,
Okay.
8 a.m. till 3:30 p.m.
Okay.
every Wednesday, 5 days a week. Yes.
I want this to be 24/7. I want to be there at 3 o'clock in the morning on a Sunday, and there's somebody there who can take my test here.
Absolutely. We're working on that, Paul. We would like to be here too as well for help the community.
And then, so you got one site, super site now. Are there others coming? You said the fairgrounds is coming.
Yes, the fairgrounds will be coming sometime in August. We're discussing with the fairground this week.
Wow.
That's amazing. We need this like months ago.
Yeah, right.
Yes,
Exactly.
absolutely.
Exactly. Any questions that your audience has, Dr. Trin? Any questions about a test or how to get a test? I think we've gone through a lot of this here. It looks so darn simple. Why did it take so long? I don't know. But that's
Yes.
for another day.
I got a question here on how do churches get involved in testing their
Yeah.
how can churches get involved in testing their church members?
Big churches, you Saddleback, or I'm a Catholic. There's a bunch of big Catholic churches. The cathedral over in wherever it is, Garden Grove. Yeah.
Right. So
How-
I don't know if there's a methodology for you guys.
Do they contact you, or are you reaching out to other things? Let's say some big church wants to, hears this and says, we want to set up a super site. How do they do it?
Oh yes, and then they can contact me as well, and then we can set one of these tents up for them, and we can have the providers on site for them. If we have a big enough parking lot, that would be great.
Is there a cost? Because I know this is obviously you're doing as an entrepreneur here. Is there a cost to them to set up a site, or do you handle all the costs and you're obviously getting reimbursed from either the county or from the insurance companies for the work you do here?
Yeah, just only we build the insurance for the medical services provided.
Right.
The county does not pay us for this at the moment. We just help us clear some barriers to have a site like this and
Yeah.
use the Anaheim Convention Center and open doors for us with the Anaheim City as well.
Why wouldn't doctors be just gravitating to this all? I don't know why there aren't a million entrepreneurs doing this, because there is obviously funding. The insurance companies are mandated. They got to pay for it, and they're going to get reimbursed from the federal government probably or something here. I don't know how the mandate works, but they have been ordered to pay for all these things, and I don't know how they cover that additional cost. But however that happens, it's happening. I mean, it's not for lack of funds. It's for lack of sites. It's for lack of equipment. It's for lack of imagination of how to organize this. It doesn't seem like it's for lack of money.
Right, and yeah, just a couple issues that we do have. It's just it takes a while, even though there is mandate from the insurance to pay for it. It's just going through claims and billing. That's why I think it discouraged some doctors to able to pull an operation like this to make it happen. Yeah, even though it's mandated, but it doesn't really say like how fast they should pay. So they're
all
kind
right.
of like the insurance, they're taking their time.
Yeah, because
So,
they've got a lot
yeah.
of checks they're writing every day here. They're going to slow down a
Right.
little bit here and write them a little slower here. And yeah.
Right.
So again, it comes down to paperwork and organization, and
Yes.
it's the chaos of who does it and how do we do it and where do we do it, and you're going to do it.
Yeah.
No, I'll do it. He's going to do it. I'll do it. And then how do we do it? You've come up with a pretty darn seamless way to do it. I pull up, I show you something through the window. I make an appointment online. I
Right.
show up. Or if I'm 65, I can just show up and say, please, I'm 65. Give me one
Oh,
of
yeah.
these things here.
Definitely.
And-
OC Fairgrounds, we will definitely have priority lanes right away because that's a big enough parking lot to take the capacity
Yeah.
and also have priority lanes.
So there's
Yeah.
the reserve. So people have reserved this one of these precious slots for today. You do that 24 hours in advance. You go online, get there early, folks, and make your reservation. And if you make it, then show up, sit in line. You show your ID through the window. You show your insurance card, because that's how you guys are going to get paid for this thing here, all the work you're doing. And then they take this long thing and they hand you this kit. And then you go and you with somebody standing there, they say, no, Paul, stick it. Come on, don't put it in your ear. Stick it up a little further, wiggle it around. And then you put it in the package, you drop it off. how long do you think this takes, depending on the wait? I know the wait can vary, but the process can't be that long. 20 minutes?
Yeah, I mean, like right now, as you can see, we only have 2 lanes flowing in because of how our system manager kind of gauged the scheduling.
Right.
So there's a rush in the beginning, and then it dropped, rush drop, and then right now we want to push all the appointments early as possible, so our staff is full of energy, and then get the cars through right away
Yeah,
with
right.
less time waiting.
What
right?
happens?
So right now, I mean, with 2 lanes, I'm seeing maybe 5 to 10 minutes really
5
to
to
get
10
through the
minutes.
whole process.
5 to 10 minutes, Dr. Trin.
Yeah.
This is what we've been waiting for.
Yes, absolutely.
It's faster than waiting in the doctor's office for your own doctor.
Faster, yeah.
That's true.
Faster. But you doctors are always backed up. I wait 20, 30 minutes. I get there on time, and the doctor's never on time. All right. Well, once again, you can go to 360clinic.md. That's .md.
Yes.
And you can sign up for this, or you can go to the county site, OCCOVID-19, that's the first part, .OCHealthinfo.com. OCCOVID-19.OCHealthinfo, that makes sense, .com, and then just look for /super site. What a super idea that you guys have come up with. I think you're gonna solve a need. You're gonna have a billion of these things here. You're going to make money. You're going to help people. We're going to get over this thing. Long overdue. Welcome. Thank you for contributing here. Any final thoughts here you want to share with us?
I can show you the last station really quick.
Yeah, please. Yeah.
Okay, we're going to go to the last station now. All right,
Right.
Andrew. Let's go to the last station.
This is so cool, Dr. Trin. We got on the ground live report here.
That's right.
Finally, a place I can go get tested. And if I'm a senior, I can literally just drive up and say, I need it. I want it.
Yeah, just show us your ID, and if you have insurance, we'll see that you're over 65 and send you to the priority lane right away.
I'm only 64. Can I squeeze through? I'm 65 in January. Can I squeeze through? Come on.
No problem.
All right, good. I must say I know Vince Tin. How do you say your last name? Tien.
Tien, Tien.
Okay.
Okay, so we're going into this parking structure now. We utilize this parking structure to have our clinicians to kind of be covered from the weather, so we can be here all day, any day. So it rains, sunshine, no problem.
You've really thought through it all.
Take this on the right side, and in the front, we'll show back. So right now, people will be driving in, and we have 2 lanes right now. We have the capacity to open 5 more lanes across the parking structure. And these are signs here. We can slow down a little bit. These are signs that showing people, kind of reminding them how to do the swab to be put to the right. And then,
Stick it in, wiggle it around, get it up there. It ain't so bad.
yeah, right. See, and then we have our providers here in PPE. Give me the emergency exit sign. Yep. And then, so the first car here, go ahead.
Wow.
So the first car here, go ahead.
This is so well organized.
Very.
Yeah. So
Where's the chaos I keep hearing about? Where's the confusion?
So
organized.
yeah.
Where's the angry people saying, I've been here for 4 hours. Somebody's got to answer my question.
Yeah, so here he's done with the swab, and we're sealing it up. And then we're collecting the swab kit here, and then just keeping it in the bin. And
Wonderful.
at the end of the day, the Progenic lab will be picking up the sample and processing right away tonight.
Gotta go, guys. I got another show starting in 1 minute. So thank you so much.
Absolutely.
Go check it out.
Thank
360
you so much, Paul,
Clinic.
for your time. Thank you so much, Dr. Trin. Have a nice day.
Take care, guys. Very good.
Okay. Bye-bye.
Congratulations.
Well, there you have it. Another reason to tune in each and every Thursday here at 8 a.m. on Orange County's only community radio station, octalkradio.net, giving you the latest info live from the ground. What's happening here and where you can go get tested immediately, today. Go. Check it out. 360clinic.md.
When you use the Premier Rewards Gold Card from American Express, the rewards points can keep on multiplying. Buy 3 with triple points on airfare. Buy 2 with double points on gas and groceries. And a single point for pretty much every other dollar.